This video is going to cover both the light touch and pressure touch sensory competency tests. This is Maddie. She's a second-year student and she's graciously agreed to help me out with the video. So thank you so much, Maddie.
Of course.
So we're going to go through the setup to start with. I may not go through that same setup procedure in all the videos just because it gets a little bit redundant. But for this one, I want you to know that the first thing you need to do before your client even arrives and even after they're here is to wash your hands. If it's the protocol at your facility, you may want to wear gloves. I'm not going to wear gloves so that you can better see what I'm doing. And then you want to have all the materials ready and nicely placed before the client arrives. We're going to sit across from the client or at an angle. We're at a bit of an angle so that you can see everything that's going on in the video. So from here on out, I'm going to run through the test, and then afterwards I'll give you some pointers and highlights of what you might want to keep in mind. Well, hi Maddie.
Hi.
How are you doing today?
Good, how are you?
I'm good, thank you for asking. So today we're going to be doing a series of tests that will test your sensation of touch and some of your other senses, and we'll be also doing some motor testing around your eyes and around your face. And I'll be explaining each test before we do it. I'll give you an opportunity to ask any questions, and then at the end, after we're done with all the tests, I'll be letting you know what I found.
Great.
Before we start, do you have any questions?
No.
Okay, and are you comfortable, or can we do anything to make you more comfortable?
I think I feel good right now, yeah.
Okay, great. So my understanding is that you had a stroke and it's affecting your right side, is that correct?
Correct.
Okay, and is it your upper body or your lower body or both?
Both.
Okay, thanks for that information. So the first, and is it okay if I touch you and actually work with you?
Yeah.
Okay, great, thank you so much. So the first test that we're going to do is called light touch. And I'm going to demonstrate on myself first so you can see what it's like, and then I will do it with you. So what I'm going to do is I'm going to fluff up the end of a Q-tip here so that it's super soft. So I'm going to be doing little touches, just very light, all over the different parts of your arm and your hand and your finger. We're going to be doing both sides. And we'll do both sides of your body as well. Okay. I'm going to start off with your left side because your left side is kind of our baseline. And then we're going to see how your right side has been affected. Okay. Do you have any questions about that before we get started?
No.
Okay, so I'm going to set aside my stuff and pull over your stuff. So if you could please put your arm on the table for me, and that's great. And does that feel okay?
Mm-hmm.
All right, so, and your fingers are fine. I'm going to start with your eyes open by just doing the touches so you can see what it's like. Okay? And for this test, because I want to test your sense of touch, I'm going to either want you to close your eyes or I can block your vision with a folder. So if I block your vision with a folder, it will look like this. Do you have a preference?
I can close my eyes.
Okay, great. And the reason that we do this test is that people's sense of light touch helps us with our motor skills, our fine motor skills, and to be skilled in using our hands. Mm-hmm. And you've probably found that your skill is decreased since you've had your stroke. Okay. We also do this test because if you have like a bug or a mosquito or some little thing on your skin, you want to be able to feel it and brush it away. So there's also a protective aspect to the skill and to the ability.
Okay.
Does that make sense?
Yeah.
Okay. With the test on your left side, I'm going to ask you to let me know when you've felt the test and felt the stimuli, and then tell me where on your hand that you or your arm that you felt it. You can say things like forearm, wrist, thumb, little finger like that.
Okay.
Okay. All right, great. So go ahead and close your eyes.
Forearm. Forearm. Palm. Thumb. Middle finger. Forearm. Pinky. Index finger. Forearm. Wrist.
Great. Let's go ahead and turn your arm over, and we'll do the same thing on the other side. So you can say forearm, wrist, hand, or whichever one of the fingers.
Okay.
Okay, go ahead and close your eyes. Great.
Forearm. Hand. Forearm. Pinky. Middle finger. Thumb. Forearm. Wrist. Forearm. Middle finger. Index finger. Pinky.
Okay, great. Go ahead and open your eyes if you haven't, and you can put this hand back in your lap, and I'm going to help you to put this arm on the table. Excellent. So now when I'm testing this side of your body, I'm going to ask you to do the same thing, but when you feel the touch, you're going to open your eyes and locate it with your other hand. Make sense? Okay. So go ahead and close your eyes. And for the purposes of this video, let's say that Maddie is going to feel about, I don't know, 50%, right? So we're going to say that, and she's in on it, so we're going to say this. Let's say that this whole aspect of her hand that's innervated by the median nerve has been affected, and so she's not feeling light touch sensation. Okay, so let's see how this works. All right. Great. Okay, now we're going to do the same thing on the back of your hand. When you feel a sensation, you can open your eyes and touch that spot. And if you'd like, you can say okay or yes.
Okay.
All right.
Yes. 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 Yes.
All right, great. And I'm going to help you to just put your arm back in your lap. Okay. So that is the test of light touch. A couple things I want you to keep in mind. You always, always, always test the unaffected side first so that you can get a baseline. You'll notice that if she didn't feel a sensation or a stimuli, I did it again just to make sure it wasn't user error, right? So it can happen that we touch too lightly and the person just doesn't feel it because of our error. So again, I don't need to say, oh, let me do this again. I just redo it. Other things to notice are we're going to be focusing on both the dermatomes and the three nerves of the arm and hand, radial, median, and ulnar. So students often ask me how many touches or how many places or which places, and there's really no solid system for that. What I try to keep in mind is that I'm going to do a series of touches here, I'm going to do a series this way, and I'm going to do a series here. Same on the back of the hand. I'm going to also look at getting high forearm, middle forearm, wrist, palm, thumb, and each of the fingers. With the fingers, you don't need to touch each of the segments of each finger. That's not necessary, but you do want to get aspects of each finger. It's okay to do it a couple times like that. But there's really no solid like formula for how much you touch and where you touch. I think that the most important thing is that you touch the areas that you think you may have gotten a user error from, again, to make sure and confirm your results. Another thing you may have noticed, and that's important to do, is that we don't want to get in a rhythm of touching. So if you'll just put your arm out again. So I don't want to do 1, rest, 2, rest, 3, rest, 4, rest, like that. I want to vary it so that she is not identifying the sense of touch just because of that rhythm. So I might do a touch, and then in my head I'll think beat 1, beat 2, beat 3, touch. And then maybe a faster one, right? So the excursion of the touch is about 1/2 inch, and it's pretty light, right? So we have this little fluffy end, and it's just a brush. And I think that those are the things that you need to know. You want to allow the client time to open their eyes and localize the touch. Of course, with the affected side, you can't have them point because they can't use that arm. So you can do what I did, or you can just ask them to tell you when they've been touched. And then you'll be recording the results. So I don't have my score sheet out because I'm focused on the administration of the test. You would have your sheet here, and after every, say, 3 or 4 touches, you would record plus, minus, or a 0. And so the testing sheet would look like she has intact sensation on both sides of her left arm, and she has intact sensation on the ulnar and radial side of her affected arm, but sensation is missing up the middle and down the middle. That's the end of the light touch test. And now, because we're doing the exact same protocol, we're going to go on to the pressure touch. Now, the pressure touch is the same setup. It's all the same materials. It's the same protocols, but rather than doing a light touch, what we're going to be doing is, and I will dispose of these and get new Q-tips, we're going to be exactly as it says, doing pressure touch. So different set of tactile receptors, and we're going to be exerting a little bit more pressure. It's hard for me to tell you how much pressure on a video, but I will be happy, or your other instructors will be happy to demonstrate on you. What I can say, if you'll put out your arm again, is that you're going to push down until you see the surface of the skin deform. I'll do that again. I'm doing this a little bit in slow motion, so when I'm at full speed, it looks like this. Now, with folks with light skin, you may be able to see a little bit of blanching of the skin, in other words, lightening of the skin. But those clients that you have who have darker skin, you won't have that cue. So what you need to rely on is your knowledge and experience of how hard to push, and also this idea of seeing the skin depress just a little bit. Now I'm going to demonstrate the test for you. As with all the tests, your hands will be washed. You will have set up prior to the testing. You will greet your client, ask them how they are, all of that part that we did in the light touch. But because Maddie is still here, I'm not going to go back through that. Maddie, we're going to now do a pressure touch test, and this is basically the same as the light touch, but pressure touch is going to enable you to feel a sensation a little bit deeper in your skin. So it might be if you have buttons that you're buttoning against your chest to feel those buttons. It may be pushing down on a bottle cap to open it, feeling that sense of how hard to push and where the ridges are so that you can effectively open the cap, things like that. And we're going to do the exact same procedure. What I'll be doing is now pressing with a little bit more force and all over your arm and hand, just as we did with the light touch. Before we get started, do you have any questions about that?
No.
Okay, go ahead and place your arm on the table, and let's do it with your eyes open just so you can see. Okay, so go ahead and close your eyes, and again, you're going to tell me when you feel a touch and just tell me approximately where it is.
Okay.
All right.
Forearm, forearm, palm, palm, middle finger, ring finger, forearm, wrist, index finger, thumb, pinky.
Great. And we're going to turn your arm over and do the same thing.
Forearm, forearm, hand, ring finger, index finger, pinky, forearm, wrist, thumb, hand, ring finger.
Great. Okay, go ahead and put this hand back in your lap, and I'm going to help you put this hand on the table. And for the purposes of this, she's got the same set of deficits, which is median nerve, okay? All right, ready to close your eyes?
Mm-hmm.
Okay.
Thumb,
And go ahead and open your eyes and point if you would. Great, thank you.
pinky, index finger, forearm, ring finger, index, thumb, forearm,
Great. And let's turn your hand over. Okay, same thing, other side. And if you'd like, you can just say okay. I love that you're localizing it, but you don't need to.
okay, okay, yes, 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 yes.
All right, great, thank you. So, some things to remember about this test. I spent more time looking at that median nerve because with the light pressure touch, I'd already discovered that the median nerve in that area of the arm and hand was impaired. So I zeroed in on it a little bit more. The client doesn't need to say, to localize it, but and they may not be able to if they have any sort of cognitive impairment or a speech impairment, right? So either an expressive speech impairment, but Maddie did a great job and was able to localize all over. So again, I'm going to record the results, and then I will share the results with the client at the end of the test. One thing that I discovered is that a couple times, if you just put your arm back up on the table again, occasionally what would happen is that I would brush her arm a little bit as I was going to touch. And that's not a big deal, but you just want to give a beat or so that you're not giving the client extra information about where they've been touched or when you're going to touch them. The other thing that I wanted to let you know is that either if you're not particularly steady, if you're nervous, or if you want to be a little bit more propped, that's what I do. So I'll bring your attention to it. So you can prop on your hand. You can prop on the side of the table, right? But if you're going up in the air and down, you're much less stable and you're more likely to kind of bobble back and forth. So as you need, you can prop so that you're in a good position. That's the end of the light touch and pressure touch video, and we'll continue on with sharp and dull.